So the chest X-ray in pulmonary embolism, unlike in CHF and unlike in pneumonia, is not particularly helpful. So I'm going to tell you 3 classic signs so you know them, so that when people talk about them, you'll sound smart, but just know that these findings are not particularly good. Diagnosing PE on chest X-ray is almost impossible. So the first one is called Hamptons hump. So let's see if we can spell this correctly. Hamptons hump. So it's described as this peripheral-based sort of wedge-shaped lesion, and this is a classic one. This is peripheral-based. Maybe it's wedge-shaped, I'm not so sure. A little bit fuzzy out in the periphery. This is pretty non-specific. That could be a little patchy pneumonia. It could be lots of other things, but that's the first one, Hamptons hump. All right, so let's do the next one. The next one is called Westermarck. Westermarck sign. And in this case, you see over this side, blood vessel, blood vessel, blood vessel, blood vessel, blood vessel, blood vessel. Over here, there is no blood vessels. So this is presumably because you've got a big clot here and it's blocking the blood getting to the lung, and so it's called Westermarck sign. It's oligoemia, so you've got no vessels here. And the best way to do is compare and contrast. So you see vessel, 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 vessel over here, here nothing, Westermarck sign. And then finally there's this one called, and I didn't know the name of this one, it's called Fleischner. It's F-L-E-I-S, Fleischner sign. So obviously named after a person. But this basically is just a big pulmonary artery, which suggests it's under big pressures because there's a big clot stuck in there. So let's go over these 3 again, all right? Again, these are very insensitive. Most people with PE do not have these. Only about 10% or less of people have these signs. So Hampton's hump, peripheral-based lesion, a little bit of fuzziness, wedge-shaped classically in the periphery. Then you got Westermarck sign, this oligoemia, no vessels in a big deficit here, lots of vessels over there. Could be anywhere in the lung, depending on where the PE is. And then there's this big pulmonary artery, Fleischner sign, because there's lots of pressures here. Again, the chest X-ray is poor for the diagnosis of PE. CT scan, much better.